All right. Uh, Hello again, everyone. My name is Marty Guthmiller, CEO at Orange City Area Health System, welcoming you to another edition of Insights. Today, you can see we're certainly not in my office. We're in the surgical hallway at Orange City Area Health System, and I have joining me today one of our new general surgeons, Dr. Dan Locker. And so we're going to get to know you, Dr. Locker, a little bit.
All right.
I don't know if you knew that, but we're going to get to know you a little bit.
Awesome.
All right. So could you tell us a little bit about yourself?
Yeah.
And we'll start with that.
Okay. Yeah. So I grew up in Orange City. I was born in Des Moines, but I spent pretty much my whole life here and went to MOC and then graduated from Northwestern College. From there, I decided that I wanted to pursue medicine. And so I went to the University of Iowa for my medical school and fell in love with general surgery. And so I completed my training at Iowa Methodist in my general surgery residency.
Good. Family?
Yep. So I have a wife and two beautiful little kids. So they're 18 months and 7 weeks now. So little.
How about a dog?
No dogs.
No dogs. Okay. All right.
For the foreseeable future, too.
Okay. So you came to Orange City to be a general surgeon.
Yes.
All right. What does a general surgeon do?
So we do a lot of things. So pretty much surgery anywhere from the neck all the way down to almost to the legs. We'll cover a lot of procedures in there.
Okay.
So hernias, gallbladders, appendix are the ones that people know about.
C-sections?
C-sections, colonoscopies. Pretty much, if there's surgery in the chest to abdomen area, we'll usually do it.
Excellent. And do it well.
Yes, that's the important part.
So do you have a favorite?
I like pretty much all of them. I really enjoy laparoscopic hernia repairs. Gallbladders I enjoy doing, as well as Nissens, which is like the stomach wrap to help with reflux.
You know, and me as a lay person, always appreciate it when there are people like you who enjoy doing things like that. So greatly appreciate that. Why did you? Well, first of all, are there certain procedures? You know, you say everything between here and there.
Yeah.
Are there certain things that people might not think about when thinking of a general surgeon or having surgery at Orange City Area Health System?
Yeah. And, so we do a lot of what most people consider to be major surgeries. So, thinking like cancer surgery. So we do, we'll deal with breast cancer here. We'll operate on that. Thyroid cancer, colon cancer. So we'll do full colon resections and take care of that. You know, those are things that people think of as larger institutions, but we do here as well.
Venous closures. I see advertisements on TV for that. Can people not go to those places and have it here?
Yeah, they can absolutely have that done here.
All right.
So one of us would be happy to take care of your varicose veins if that's a problem for you. Perfect.
Why did you decide on Orange City Area Health System? What was the draw?
Right. So I had a little bit of insider knowledge, I'll be honest, with my father's also a general surgeon here. But that in of itself wouldn't be enough to just draw me here. I knew the culture here was exceptional. You have a very collegial group of people here that are willing to work well with each other. And then also the town itself is super nice, and it's a great place to raise a family, which is something that was high on our priority list as we have young kids right now.
Perfect. Great. Well, we're certainly glad you're here. I appreciate that.
Thrilled to be here. So,
you are one of 3 general surgeons on staff.
Mm-hmm.
The team also includes much more than that. I mean, you guys have a lot of folks that form this team, including anesthesia, surgical nurses, surge techs, other support staff, Jane, the toast maker, perfect toast every time. Yeah. But we also have other specialties, orthopedics, ophthalmology, ENT, that kind of thing. We're proud to say that our team consistently scores very high in patient satisfaction, and I just happen to have some stats here with me. And for example, last quarter, 100% of the people served here, 100% gave us the highest rating possible in courtesy, respect, and friendliness. 100% gave us the the highest score on concerns listened to and responded to. That 100% again responded to that privacy was respected. Probably overarching is overall quality of care was at 100%. Awesome. And for 5 consecutive quarters, for the last 15 months, 100% of people who have had surgeries here that have responded to our surveys have said that they would highly recommend Orange City Area Health System as a place to go. Have you experienced that time? And so you've been here a year. Oh, almost, not quite, 8 months.
Yeah.
Have you experienced that kind of care?
Absolutely, yeah. No, when I, interact with the nurses here and, see the way they treat the patients as they come back, compared to where I trained, which I thought was a very good, like they're all leaps and bounds above that. They're just so friendly, so nice, and, just provide excellent care, in my opinion.
Yeah. So the personal care aspect is really one of a special element that we can provide. Last question. What have you experienced as your relationship with the rest of the healthcare team here? Yeah. People just don't decide to come have their hernia repaired. Usually they go to the family practice doc who refers you to them, or what have, or if something comes from physical therapy or whatever. So have you experienced an integrated function of Orange City that's been good for you, the coordination of services? Could you talk a little bit about that?
Yeah, no, it's been, as a new provider here, it was super easy to step in and just feel like I was able to get in contact with the people I needed to, referrals getting set up, like that was easy to do. I feel like at any point I could reach out to any of the providers if I have a question, and I feel like they feel the same way about myself and the other surgeons here. And so that just allows for ease of communication and just like information that everybody knows, what's going on, so that we can provide the best care that we can to patients. I think it's exceptional here.
Perfect. Well, thank you for being willing to talk to us this morning. And more importantly, thank you for being on our team. Yeah. And thank you for being part of our community, both you and Ashley and kids.
Yeah.
So I appreciate that.
Yeah, no, it's our pleasure.
Thanks everyone for joining us for this edition of Insights.